Research study designs fall into one of three major types or categories of research: descriptive, exploratory, and experimental. I will first describe these three major categories, and then we will explore various research study designs and how they fit into these three categories. Descriptive research is designed to document the factors that describe the characteristics, behaviors, and conditions of individuals and groups. Descriptive studies document the nature of existing phenomena and describe how variables change over time. Often, this information is used as a basis for formulation of research hypotheses that are tested using exploratory or experimental designs. Descriptive statistics are used to analyze the data collected in descriptive research studies and will be presented later in this course. Examples of this type of research are to document the 10-year progression of symptoms of Alzheimer's disease, or to document the gender frequency or average age of onset of spinal cord injury. Exploratory research is the systematic investigation of relationships among two or more variables. Researchers use this approach to predict the effect of one variable on another, or to test relationships supported by clinical theory. Examples of this type of research is to study the relationship between long-term medical conditions and depression, or to determine the association between decreased muscle mass and strength with loss of mobility and function in older individuals. Another good example is to determine the risk of disease associated with specific exposures. Analytical statistics may be used for exploratory research designs. The purpose of experimental research is to evaluate the cause and effect relationship between a set of independent and dependent variables. The researcher manipulates the levels of the independent variables and incorporates elements of control, so the evidence supporting a causal relationship can be interpreted with confidence. The term clinical trial is often used to describe experimental studies that examine the effect of interventions on patients or community populations. It may be either therapeutic or preventive trials. Therapeutic trials examine the effect of a treatment or intervention on a particular disease, whereas preventive trials evaluate whether a procedure or agent reduces the risk of developing a disease. Analytical statistics are used for experimental research designs. There are many different types of research or research designs that primarily belong in the descriptive research category. These include developmental research, normative research, qualitative research, descriptive surveys or questionnaires, and case studies. As is noted in the graphic, though these research designs are primarily descriptive in nature, they may also reveal relationships between data. Each of these research designs will be discussed individually in the next 5 slides. Developmental research is the description of developmental change and the sequencing of behaviors in people over time. For example, the classic descriptive studies of Gesell provide the basis for much of the research on sequencing of motor development in infants and children. Erikson's studies of lifespan development have contributed to an understanding of psychological growth through old age. Normative research describes the typical or standard values for characteristics of a given population. The utility of evaluative findings in the assessment of a patient's condition is based on the comparison of those findings with known standards of performance. For example, joint motion is compared with ranges within normal limits, and nerve conduction velocities are interpreted with reference to normal values. Clinicians need these standards as a basis for documenting the existence and severity of weakness, limitations, and patient problems as a guide for setting goals. Qualitative research describes the complex nature of humans and how individuals perceive their own experiences within a specific social context. Qualitative methodology uses the subject's own words and narrative summaries of observable behavior to express data, rather than numerical data derived from predetermined rating systems. The qualitative approach emphasizes an understanding of human experience, exploring the nature of people's transactions with themselves, others, and their surroundings. Data are often generated either through observation, interviews, or narrative responses to questions on a survey or questionnaire. Descriptive surveys or questionnaires are often used to collect information about a specific group to describe their characteristics. If the survey or questionnaire contains open-ended questions requiring a narrative response, then the survey has some qualitative research aspects to it. If the survey only contains closed-ended questions where the subject picks from a series of options, then the survey is only quantitative in nature. The purpose of this approach is to provide an overall picture of the group's characteristics, but may involve some correlational interpretations regarding associations among certain variables. The case study or case report is an in-depth description of an individual's condition or response to treatment. A description of interesting, new, and unique cases is necessary to build a foundation for clinical science and as a means of sharing special information among professional colleagues. There are many different types of research or research designs that primarily belong in exploratory research category. These include cohort studies, case control studies, correlational or predictive research, methodological research, and historical research. As is noted in the graphic, though these research designs are primarily exploratory in nature, they may also represent descriptive or experimental types of research. Exploratory research may be carried out retrospectively or prospectively, and may also be longitudinal or cross-sectional in nature. Prospective research variables are measured through direct recording in the present, where the researcher follows subjects as they progress through their treatment or evaluation. Retrospective research involves the examination of data that have been collected in the past, often obtained from medical records or databases. With retrospective studies, the researcher does not have direct control of the variables under study. In a longitudinal study, the researcher follows a cohort of subjects over time, performing repeated measurements at prescribed intervals. In a cross-sectional study, the researcher studies a group of subjects at one point in time and draws conclusions about a population by comparing their characteristics. Each of the 5 types of exploratory research designs will be discussed individually in the next 5 slides. A cohort study is an observational design in which a specific group is followed over time. The subjects, for example, are classified according to whether they do or do not have a particular risk factor or exposure, and followed to determine disease outcomes. A case control study is a method of epidemiologic investigation in which groups of individuals are selected on the basis of whether or not they have the disorder under study. Cases are those classified as having the disorder, and controls are chosen as comparison groups without the disorder. The investigator then looks backward in time via interview, survey, or medical record review of previously collected data to determine if the groups differ with respect to their exposure histories or the presence of specific characteristics that may put a person at risk for developing the condition of interest. Correlational research describes the nature of existing relationships among variables. Researchers will often look at several variables at once to determine which ones are related. Data from this type of study often provide the rationale for clinical decisions or the generation of hypotheses. A predictive correlational study is designed to predict a behavior or response based on the observed relationship between that behavior and other variables. This approach is especially useful for validation of diagnostic and prognostic information. Methodological research involves the development and testing of measuring instruments for use in research or clinical practice. For example, the development of the dynamometer to measure hand strength, or the development of the functional independence measure. Historical research involves the critical review of events, documents, literature, and other sources of data to reconstruct the past in an effort to understand how and why past events occurred. Historical research can build a foundation for interpreting current clinical theory and practice, providing a context within which we can evaluate professional trends. As referred to in the presentation on evidence-based practice, systematic review provides a structured approach to summarizing existing information on a selected topic by a review of published literature within the exploratory or experimental categories of research. A qualitative systematic review is completed using a structured format, but no statistical analyses are completed. A quantitative systematic review, also called a meta-analysis, is a review of similar experimental design studies on the same topic, with statistical analysis applied to determine overall outcome. There are three research designs that primarily belong in the experimental research category: single-subject designs, quasi-experimental designs, and true experimental designs or randomized controlled trials. Each of these will be discussed in the following 3 slides. Single-subject designs draw conclusions about the effect of treatment based on the responses of a single patient under controlled conditions. Through a variety of strategies and structures, these designs provide a clinically viable, controlled experimental approach to the study of a single case or several subjects, and the flexibility to observe change under ongoing treatment conditions. This topic will be addressed in more detail later in the course. Quasi-experimental designs utilize similar structures to true experimental designs, but will lack either random assignment or comparison groups, or both. Therefore, the level of evidence for such studies is either level 2 or level 3, as noted in the evidence-based practice presentation. In a level 2 study, there is no randomization of subjects between the study groups, and in a level 3 study, there is no control group. Therefore, in a one-group pre-test, post-test design, subjects receive a pre-test, then an intervention, and then a post-test, but there can be no randomization between groups as there is only one, and there is no control group. Although the researcher may demonstrate change in the dependent variable, there is always the possibility that some events other than the experimental variable occurred within the time frame of the study that caused the observed change. The purpose of a true experimental design is to provide a structure for evaluating the cause and effect relationship between a set of independent and dependent variables. Within the design of a randomized controlled trial, the researcher manipulates the levels of the independent variable and incorporates elements of control so the evidence supporting a causal relationship can be interpreted with confidence. This completes the presentation on the different types of research study designs.